Insulin resistance is a condition where your body's cells become less responsive to insulin, making it difficult for glucose to enter cells effectively. As a result, your blood sugar remains higher than normal, while your pancreas produces more insulin to try to compensate. This ongoing cycle is concerning because insulin resistance often develops silently for years in millions of people worldwide. Shockingly, about 1 in 3 adults currently have insulin resistance, but most remain completely unaware of it. Doctors refer to this condition as pre-diabetes because it is a major warning sign that diabetes may soon develop without intervention. Insulin, a hormone made in the pancreas, acts as a key that unlocks cells so that they absorb glucose from the bloodstream. When the cells stop responding to insulin's signal properly, the glucose stays in the blood instead of providing energy to the body's cells. Over time, the pancreas tries to overcome resistance by releasing even more insulin, often straining and exhausting itself. Eventually, the pancreas may not be able to keep up, and blood sugar levels rise dangerously, leading to type 2 diabetes. Several risk factors contribute to insulin resistance, including excess weight, sedentary lifestyle, poor diet, genetics, and age. Carrying most body fat around your abdomen is especially linked to this condition and further increases your health risks. Genetics can play a significant role, putting some people at risk even with a relatively healthy lifestyle. Age increases the likelihood of insulin resistance, particularly after age 45, as body metabolism naturally shifts over time. A diet high in processed foods and sugary beverages promotes blood sugar spikes and contributes to the development of resistance. Physical inactivity leads to fewer muscles using glucose, which makes cells even less responsive to insulin over time. Many symptoms of insulin resistance are mild or go unnoticed, such as increased fatigue or difficulty focusing. Other common signs may include feeling extra thirsty, frequent urination, and unexplained hunger even after meals. Some people might notice dark, velvety patches of skin in body folds, called acanthosis nigricans, which can signal resistance. Metabolic syndrome is a cluster of conditions strongly linked to insulin resistance, including high blood pressure and cholesterol. Having metabolic syndrome greatly increases your risk of heart disease, stroke, and full-blown diabetes. Fortunately, insulin resistance can often be improved or even reversed with targeted lifestyle changes. Losing weight, especially around your waist, helps restore insulin sensitivity and reduces your chances of progressing to diabetes. Regular physical activity is crucial because it moves glucose into cells where it is needed and burns excess sugar. Aim for at least 150 minutes of moderate exercise per week, such as brisk walking, cycling, or swimming for best results. Improving your diet to feature more whole foods, vegetables, healthy fats, and lean proteins can stabilize your blood sugar. Cutting down on highly processed snacks and refined sugars reduces demand on your pancreas and helps cells respond better. Managing stress and prioritizing good sleep hygiene each night play vital roles in keeping your hormones balanced and cells healthy. Consistent sleep of at least 7 hours per night improves insulin function and promotes overall metabolic health. Routine health checkups and blood tests can detect insulin resistance early, even before obvious symptoms appear. Doctors may use blood tests such as fasting glucose, insulin levels, and hemoglobin A1C to spot early warning signs. Jonathan Smith, an endocrinologist, recommends acting quickly if you learn you have pre-diabetes or related risk factors. Smith reminds patients that even small changes, like walking after dinner or swapping soda for water, can yield noticeable results. If lifestyle efforts are not enough, physicians may prescribe medications that help the body use insulin more efficiently. Managing insulin resistance is a lifelong commitment, but each positive step dramatically lowers your risk for serious complications. Remember, insulin resistance rarely has dramatic symptoms, so being proactive and informed is your first line of defense. Insulin resistance means cells respond poorly to insulin, raising blood sugar. About 1 in 3 adults have insulin resistance, often unaware of it. Risk factors: excess abdominal fat, poor diet, inactivity, age, genetics. Lifestyle changes like